Hi, my name is Dr. John Schnorr. I'm one of the founding partners of Coastal Fertility Specialists, and I'm excited to be here with you today. Today I wanted to talk with you about a very common test that we do for women to help understand any female causes of infertility called a hysterosalpingogram, and also known as an HSG. A hysterosalpingogram is a test that allows us to evaluate whether or not the uterine cavity is normal on the inside, and more importantly, are the fallopian tubes open and working. If you go to Dr. Google, you'll learn a lot of bad things about a hysterosalpingogram, and I wanted to teach you the Coastal Fertility way to reassure you that you're in great hands. At Coastal Fertility, we've purchased some very special equipment, and we have extra training to perform hysterosalpingograms. The extra training and special equipment allows us to do this testing at a much quicker rate with a more accurate result, and more importantly, a significant decrease in pain associated with the procedure. It's a test which is typically done between the day of your last day of menstrual flow and ovulation, which for most women is generally between day 5 and day number 14 of the cycle. If you don't have any menstrual cycles at all, we can pretty much do it anytime during the menstrual cycle. Turns out that we start first with a pregnancy test to make sure you're not pregnant. In the rare chance you could have conceived, we would not want to expose you to any radiation treatment. And so we would first do a urine pregnancy test at the office. I'll then come in and sit with you and talk to you about a hysterosalpingogram and some of the details. We'll then actually proceed forward and have you slide down and get in a regular lithotomy position where a speculum can be placed in the vagina. And then we'll put a little bit of brown soap onto the cervix. The soap is called betadine. Betadine is lower the chance of infection. We then put a catheter that goes into the cervix, and then I inject a small amount of dye up into the uterus while we do x-rays. And during the x-rays, the x-ray beams are actually blocked by the dye we put into the uterus, which then allows us to watch to see if the dye goes into the uterus, how the shape of the uterus is, and then watching the dye come through the fallopian tubes at the end. The whole procedure length, probably 3 to 4 minutes from start to finish. At the end, we'll have immediate results, and I'll be able to print the results for you and give those to you so that you have those. You have a kind of menstrual-like cramping during the center of the procedure. Generally is not worse than a regular menstrual cycle. Cramping lasts for about 3 to 4 minutes after the procedure and then gradually goes away. Typically there's vaginal discharge associated with the clear dye that we put in the uterus. We generally put about 5 to 10 cc's of dye into the uterus, so a little bit of that comes leaking back out with a little bit of a brown discharge from the soap that we originally put onto the cervix. When you're done, pain just gradually drifts away, and within an hour after the procedure, generally you're pain-free. Really actually within 3 to 5 minutes after the procedure, 95% of the pain's gone. We use antibiotics for women who are at increased risk for an infection from the procedure, and those patients who are at an increased risk are typically patients who have had abnormal hysterosalpingograms in the past. Maybe prior ectopic pregnancies would be a risk, prior history of sexually transmitted diseases, a lot of pelvic surgery in the past would all be risks. And in that circumstance, we give a medication called doxycycline, which is an antibiotic. You take it for 2 to 3 days before the x-ray, and then for generally about 5 days after the x-ray. After the x-ray, again, pain will quickly go down to normal within about 5 to 10 minutes. If you start having any significant pain over the next several days, we'd like you to call the office. If you have a fever, which in medicine is really a documented fever of greater than 100.5 degrees Fahrenheit on 2 separate occasions, at least 2 hours apart. If you have a fever, give us a call. You don't need to take your temperature, just do your temperature if you think you have a fever. Or if you have any other concerns about the procedure, let us know. But my experience regarding a hysterosalpingogram is that patients really worry about that for 2 or 3 days before the procedure and then leave thinking, that was nothing, it was no big deal. And so my job today is to reassure you we're going to take good care of you, we're going to get instant results, and with that help to identify whether the uterus or fallopian tube could be a cause of your infertility. If you have any questions, let us know. Our phone number is 843-883-5800. We'll see you soon.